welcome to the second night of our Diabetes Awareness Challenge. We're so glad you've joined us this evening. November is designated as Diabetes Awareness Month, and we're shining a light on this epidemic that truly is ravaging our country. Last night, we had a great kickoff to our 4-day challenge, and our guest speaker, Dr. Loida Brooms-Williamson, shared with us about stress and what, as a diabetic, you can do to help manage the stress that just comes from having that chronic illness. Before we get started tonight, I want you to share this live video with your friends. Share it with your friends, your family, share it to your Facebook page, start watch parties, do whatever you can to get the word out. Last night's information, that presentation was so impactful, so informative, and we're going to hear some great information tonight as well. So we just want to share it with everyone. Remember, the hashtags to use are Team Destiny and Diabetes Awareness. This is how we're going to track your engagement for the wonderful prizes that we will be giving out during our challenge. We've got some amazing prizes, and last night, Carolyn A. won a $50 Amazon gift card just for registering, showing up, sharing the video, and engaging with us. I mentioned last night some statistics related to diabetes. And to me, it's really astounding that over 34 million individuals in our country have diabetes. And of that number, about 7.5 million of them don't even know that they have diabetes. I want you to think of those figures a little bit differently. 34 million accounts to 10% of the population in the United States. Just think about that. 10% of the population have diabetes, and think about the impact on quality of life. Think about the cost burden, and think about all the other diseases that are related to diabetes, that are complications of diabetes. I hope on Sunday evening, Dr. Dwayne Wood will share a little bit more in detail about that so that we really understand the impact and just how widespread the impact of diabetes is. The other thing I mentioned was the fact that about 88 million individuals in our country have prediabetes. Think about that also in a little different way. That accounts for about 34% of the US population, a third of the individuals. So that's 1 in 3. If you look to the right, look to the left, then those two people more than likely have prediabetes. So we're shining the light on diabetes. We're wanting to make just a general population more aware of the impact that diabetes is having on our country. And that's why I referred to it earlier as an epidemic, because it truly is. So tonight, our speaker is Dr. Desiree McGann, and she will be talking about diabetic foot care. Now, Dr. McGann attended the Scholl College of Podiatric Medicine in Chicago, Illinois. She received her training both in Chicago and in New York. And she currently practices in Scottsboro, Alabama. Her business is called Mobility Care. And we're grateful that Dr. McGann has agreed to share with us and give us some insights about taking care of our feet if you're diabetic, and just helping us understand the impact and the complications that so many of us can see. Maybe we have family members who have had to have their limbs amputated. And, you know, it's really heartbreaking when you see people who have essentially become disabled because of this condition that can be quite crippling. So, welcome, Dr. McGann. We're looking forward to hearing what you have to share with us. If you all are ready to hear Dr. McGann's presentation, please go ahead. Just put ready in the comments. Let us know that you're ready to hear and that you're receptive and that you're going to avail yourself of the information she's going to present to us tonight. Thank you, Dr. McGann, and once again, welcome.
Thank you, Charmaine. Thank you so much. I appreciate the chance to talk with you guys about this condition because it is like you said, it's an epidemic. The amount of people affected and the ways people are affected. And like you said, many people don't even know, 1 in 3 people don't even know they're pre-diabetic. And a lot can be done to prevent some of the worst aspects of it and to manage a condition. But awareness is the thing. You have to know what you need to know. So I have a bit of a PowerPoint slide I'm going to share with you guys that kind of talks about the way I like to talk about diabetes. It's the idea of having an ounce of prevention. It's the idea that if you can take some steps, you can go a long way towards mitigating some of the effects of the feet because they are quite devastating. So the first thing to think about is the scope of the problem. So the real cost of diabetes is the complications, which are very common and costly. So Charmaine mentioned 88 million, 34 million people in the U.S. with diabetes, 10% of the population. The cost in terms of dollars and cents, $245 billion each year, 176 billion in direct medical cost, and 69 billion in indirect costs. We're talking about disability because of limb loss, reduced productivity, and premature death. So it's a lot, the cost in terms of dollars and in terms of lives and quality of life. The diabetic effects is the fact that up to 25% of those with diabetes will develop complications. Most of them will develop a foot ulcer, and that to deal with that's like a part that is 15 billion of the total cost. So that's quite a bit. What we've found is that Medicare, for example, every dollar invested in care by a podiatrist, a foot specialist, returns $9 to $13 in terms of savings, and of course, 80% rates of amputation can be reduced, or amputation can be reduced up to 80%, which is amazing. And the idea is, overall, they've figured out that if you can do things earlier, you can definitely contribute to better quality of life and care. So the dangers. So something else too, with these pre-diabetic folks, the feet can reveal diabetic warning signs. So a lot of people will tell you that they realize they had diabetes after noticing some things. So numbness in the feet, redness in the feet, swelling, or wounds that don't seem to heal as they usually do. Those can often be signs that there's something going on. And that can probably clue some of the pre-diabetic folks in to let them know that they're having some issues. The dangers continue. People with diabetes are at a greater risk of injuring their feet because of loss of sensation caused by nerve damage. And these injuries don't often receive prompt attention, and they can easily develop serious infections. And if left untreated, they can cause deformity in the bones of the foot or the feet, and that can cause further problems as you go along. Also, decreased circulation. Diabetes seems to reduce blood flow to the feet, making it harder to heal an injury or resist infection. So even a small cut, which you think, oh, no big deal, can produce serious consequences. This can cause trouble healing once an injury or an ulcer develops. And diabetic ulcers precede 85% of diabetic-related amputations. More dangerous. Because of these problems, like I said, you may not notice a foreign object in your shoe. As a result, you develop a blister or a sore. This could lead to infection, non-healing wound, and put you at risk for amputation. So the risk. So you're at high risk if you have any of the following. If you have neuropathy, which is again the strange nerve sensations in your feet. If you have poor circulation. If you have foot deformity, a bunion, a hammer toe, prominent bones, weight-bearing areas. If you wear inappropriate shoes. If you have uncontrolled blood sugar, or if you have a history of a previous ulceration. So to avoid serious foot problems that could result in losing a toe, a foot, or a leg, there's some guidelines that you really want to keep in mind. So what you want to do, most important thing is to inspect your feet daily. We talk about breast exams or so, people going for prostate exam. The feet exam is right up there for people with diabetes. You check for cuts, blisters, redness, swelling, nail problems, nail discoloration. And you may have to use a magnifying hand mirror to look at the bottom of your feet or have someone in the family take a look at it for you. And if you notice anything that's not quite right, you call your doctor. The reason that's so important is because you may not always feel things. I've had patients that had ticks on their feet and they had no sensation. They didn't know it was there. They came in and I said, well, what is that? And it was a live tick. So things like that. So yeah, things like that can happen quite easily because you don't feel it. Bathe your feet in lukewarm water, never hot water, never hot water, never hot water. Use lukewarm water, the temperature you would use on a newborn baby. And the thing to do is to check the temperature with your hand, not your feet, because if you don't have good sensation, you won't know it's too hot. Be gentle when bathing your feet. Wash them using a soft washcloth or sponge. Dry by blotting or patting and carefully dry between the toes. This is really, really, really important. Carefully dry between the toes. Moisturize. Moisturize your feet, but not between your toes because the toes, it's naturally moist in between there. So you don't want to add to it. Use a moisturizer daily to keep dry skin from itching or cracking. Again, don't moisturize between the toes. And what you want to make sure you do is you need actually a pretty thick moisturizer, especially for the bottom of your feet, because the skin is thicker on the surfaces you walk on, just like the palm of your hands. And so you need something. You can't just use a regular, something from some body lotion type of thing. You need something more, a thicker thing for the feet. Also, cut nails carefully. Cut them straight across and file the edges. Really important. Don't cut them too short, as this can lead to ingrown toenails. If you have concerns about your nails, discoloration, thickness, flaking, it's best to consult your doctor. Now, never, never, never treat corns or calluses yourself. Do not do bathroom surgery. Don't take the razor blade or the whatever knife, pocket knife, and definitely do not use medicated pads. When you walk into the aisle that sells food products, please walk by those. The reason, again, has to do with the sensation. If you can't feel it, the pads are acid, usually have acid in them, and they will burn through the skin, and you will not realize it until you notice some redness or something. Someone notices that, and that's a real situation. So if you have something that you think you want to deal with yourself, or put some pads on it, it's best to not do that. To have your doctor look at it for appropriate treatment. And wear clean, dry socks and change them frequently, change them daily. And actually, another thing about the socks, you want to use like socks that are not dyed. You don't want to use dark colored socks. You want to use white socks. And the reason why is because they wick away moisture. The white socks, the dyes can be problematic and can make your feet sweat and create an environment that is more conducive for bacterial growth. So then consider also socks made specifically for patients living with diabetes. And these socks, really, what you're looking for is socks with extra cushioning that don't have elastic tops and are higher than the ankle, that goes above the ankle, and made from fibers that wick away moisture from the skin. So you don't have to break the bank, but you want to be careful with the socks you buy to make sure that they're not going to cause restrictions and constrictions. Also, wear socks to bed. If your feet get cold at night, wear socks. Never use a heating pad or hot water bottle for the same reason, because the sensation may be an issue and you don't want to take that chance. And of course, if you notice that your feet are cold all the time, that can also be a problem with the circulation. So you may want to get that checked out as well, especially at nighttime when you lay down, because when you lay down, the blood is challenged to flow. When you're walking up and about, it's not so much of a problem. So it could also indicate cold feet at night, could also indicate a problem with your circulation. Also, shake out your shoes and feel the inside before you put them on. That's really, really, really important. You may not be able to feel a pebble or other foreign objects, so you always have to inspect them before putting them on. Just make it a practice. It's something you just want to start doing. Also, keep your feet warm and dry. Don't let them get wet in snow or rain. Wear warm socks and shoes in the winter. If you don't like to wear socks, at least keep them in your car. So in case you end up in a place in the winter where it's cooler than you think, or the temperature goes down, your feet are protected. You have your socks to put them on, rather. Also, never walk barefooted, not even at home. And wearing socks at home is the same thing as walking barefooted, unless you have those really, really thick socks with like a rubber bottom. Always wear shoes or slippers because you can step on something and get a scratch or a cut. I had a patient once that was really careful about this, and her niece came to visit, and I don't know why it was. She was sewing something, dropped the needle on the ground, and the patient stepped on it. When the few times she actually walked without any shoes on, and she didn't realize until she started notice drainage on the ground, and turns out she had stepped the needle had embedded in the foot and was causing an infection. Also, take care of your diabetes. Keep your blood sugar levels under control. Extremely important. Keep up with your A1C. When the blood sugars are high, it's hard to heal anything. It's like the cells of the red blood, the cells that fight infection tends to be kind of in a stupor with the high sugars, I always say. Other things to think about, smoking, do not smoke. Smoking restricts blood flow to the feet. It causes constriction of the blood vessels. And so if you have reduced blood flow because of the diabetes, it's just a double whammy with the restriction from the nicotine. And so this is also the same for vaping. Anything that is the nicotine that causes the constriction. So smoking, cigarettes, cigars, anything that brings it in the system, vaping, all the same thing. In fact, vaping is a little worse because it actually concentrates. It gives you a higher percentage of the nicotine. So, and also get periodic foot exams. Seeing your podiatrist on a regular basis can help prevent the foot complication of diabetes. Also, when you go to your family doctor for your regular visits, always take your shoes and socks off. Have them take a look at your feet. They might notice something. That should be part of it. You should always take the shoes off so they can see it. Don't just leave it on there. And speaking of podiatrists, we really are your feet's BFFs. We actually are trained to manage conditions specifically in the feet and ankles. That's like all that we do. We help to prevent serious, sometimes life-threatening complication before they happen. My best patients are the ones that, even if it's nothing, they come and say, hey, what's up with that? And it's nothing, no problem. But if it's something, we can actually knock it out before it gets going. It's always easier to prevent than to have to run interference or trying to do something else afterwards. We specialize also in limb spare and wound care and orthopedic procedures for preventive amputation. It may be to change your shoe, maybe some inserts, maybe different things. But the goal is to prevent amputation, is to keep both feet and all 10 toes. Studies actually show that care by podiatrists can reduce limb amputation among people with diabetes to an astounding 80%. That's a lot. And saving limbs keeps people with diabetes mobile, increasing quality and quantity of life, which is what it's all about. So here we are. Actually, this one says 85%, so it's 85, but it's up there. So including a podiatrist in your diabetic care can reduce the risk of amputation up to 85%. And so yes, in diabetes and your feet, prevention and management is the key, because an ounce of prevention is worth a pound of cure. And that is the end.
Thank you so much, Desiree. That information was very helpful. I'm hoping our audience took notes, and hoping that they've come up with a few things that they can do, particularly if they have diabetes, to take care of their feet. We've got a few minutes for questions. Maybe we can take one or two audience questions. And so we've got a question: what moisturizer do you recommend? Is there a specific brand that you recommend?
So keeping in mind that what you want is, especially the bottom of the feet, something that's going to address that dryness. If it's really, really bad, I actually like Bag Balm. Bag Balm is an old-fashioned, I think it has lanolin and medication. Sort of looks like Vaseline, but it's thicker, and it has like, I think, is it menthol? But it's really, really good for really, really dry skin. You do that with a sock over it, and that usually will be really good for really dry skin. If it's not so bad, and just for regular maintenance, Eucerin is great. Nivea is great. There's also a concoction that among my patients have been using that many dermatologists recommend. It's Baby Magic lotion, Vaseline, and vitamin E oil. There you are. All to mix in equal part. You get to mix in small doses because it's hard to mix it, but it works really well. It's actually very moisturizing. It literally lasts. Vaseline by itself doesn't confer any moisture. It simply seals. And so you need something that's going to moisturize the skin.
Okay, awesome. Thank you. I like something for my feet because they tend to be dry. It's O'Keeffe's Healthy Feet. Are you familiar with that?
I don't think I know that one.
Okay.
But
Okay.
it works. I'll have to look into it. I'm always looking for new things that work. So I'll
Okay.
put that down.
All right. Um, any other questions? Can you use aloe vera leaves or maybe the gel?
So,
Yeah, yeah, I guess the gel.
you can really use anything. What you'll notice is if it sticks or not, like if it actually works. Like I said, the think of it, the bottom of your feet is where the trouble usually comes in. It's thicker, especially even in the summertime. If you wear a lot of sandals, you'll find that the back of your heel gets really dry. And so it needs a deeper moisturizer. And it's always better to put it on after you've taken a shower or bath because then it's going to penetrate the skin better. You don't want to wait until it dries up too much. But yeah, I would try it. I don't see why it wouldn't work, but you may find you might need something thicker, especially in the colder winters, the colder weather too.
All right. Any suggestions for folks with plantar fasciitis? We've got some great questions tonight.
Yes. So there's two things. There's two things. Plantar fasciitis is similar to, it's where the fascia attaches to the bone, right, in the heel, or like a rotator cuff or Achilles tendonitis. The idea is that as you get older, you lose that flexibility of the band that holds up the arch. And so what you need to do, it has to be a couple of things. You have to stretch. As you get older, it's all about the flexibility. You have to stretch it specifically for that. And then you have to get supportive shoes. One of my favorite pair of shoes to wear these days, and you can wear them, for the house or for, inside, outside, or whatever, are the OOFOS, OOFOS. They give amazing support, and they really do prevent a lot of that strain, especially around the house, because people have hardwood floors and tend to have a trouble in the house with that. But yeah, stretching is your big deal. You got to stretch. Just make yourself do it, and good shoe wear will help.
Okay, thank you so much for taking the time to share the presentation and even answering some of our viewing audience's question. And so I got several takeaways from your presentation tonight. We've got one more question
Mhm.
that I think is important enough for us to take. I've been a type 2 diabetic for the last 20 years. I'm in my 70s. I'm beginning to feel tingling on the bottom of each foot. What treatment do you recommend? And he says, great presentation.
Thank you, Mr. Chambers. Thank you so much. Yeah, the tingling, well, okay, couple of things. The tingling could be from the diabetes if it's well maintained, if your sugars are good, your A1C is good. It could be just a complication. And so what you want to do is make sure those things are well kept. A couple of things you can actually do to help it. You can put like topical, like capsaicin type things on there. You could use the CBD. The oil, the oral actually helps pretty good, the hemp derived type. It seems to help in neuropathy if that's what you're starting to have. Stay active, circulation, if it's sometimes this increase in circulation helps. So continue walking and doing all that. But do have it checked out just to see. And if, they can always do nerve conduction tests to see if there's anything else that's going on to make sure that's, to see what it might be.
Okay, thank you. Thank you. Great, great response. So I'm going to give a couple of calls to action. I think your presentation was really clear. So 3 things I'm going to recommend that our viewing audience takes into consideration, particularly if you have diabetes. The first one, is the daily foot inspection. That's critical because you want to just um, be sure that, like you mentioned, you don't have any cuts or bruises or even, my goodness, a tick in your foot. And then the second thing is, if you don't have house shoes, go out and get yourself a good pair of house shoes, right?
The OOFAs are really good.
Christmas time, you could even put it on your Christmas list. Get a couple of pairs. So house shoes. And then the third thing is, if you have diabetes and you have not had a foot exam, schedule a foot exam so that, we can, like you mentioned, prevention is worth a pound of cure. So we want to make sure that we're getting these things looked at. The numbers were pretty impressive. Getting regular foot exams or being under the care of a podiatrist can decrease your risk of foot complications by 85%. That's something simple to do. So guys, go ahead and schedule that foot exam. Okay. Now, I want you to put in the comments which one of those items you're going to do. Which of these calls to action are you going to fulfill? I want you to commit to it. And so write it down, and that's going to be your commitment. For the rest of us, let's keep the conversation going. Let's stay engaged. So you can comment on someone else's comment or just simply like the comment. By doing so, we're going to reach a larger audience. This is vital information. I think it's important for everyone as much as possible to hear this. And by keeping the engagement going, we're going to just broaden our reach. So more people will see it, the more we like and comment. All right. So Dr. McGann, thank you once again for taking the time to share this information with us. It was invaluable. And I believe it could possibly prevent someone who is viewing this to have the complications that we know can affect people with diabetes, can affect their feet. So thank you so much.
No, thank you. Thank you. Thank you.
Okay.
Good audience.
All right. So guys, tomorrow evening, we're continuing with our giveaways. So we're going to have on the table a meal planning session with a registered dietitian. We also will have a nutritional supplement called Weight Wise. This supplement is used for people who want to lose weight. It contains CBD and it also contains Garcinia cambogia. And during this COVID period, I, unlike so many people, have not succumbed to what's termed the COVID-19. So I'm proud of that. And one of the things that's helped me is the Weight Wise spray. So guys, remember to be entered in the contest for the prizes, or to be entered into the drawing for the prizes. You have to register. Register at www.dewcenter.com. That's dewcenter.com. And you want to invite your guests, share the live feed, and you want to be engaged in the conversation. So that's what you'll have to do to win the prizes. Now, for tonight's winners, just for showing up last night, for registering, inviting their guests, and sharing the live feed, we've got two winners. First, we've got Miss Monica Whitehead, and we have Mr. Joseph Price. Are either of those individuals with us tonight? If you are, just say, I'm here. Put that in the comments. Congratulations, guys. And I hope these products will be helpful. These supplements will be helpful to you. If you can't use them yourselves, then feel free to share it with a close friend or family member. Well, once again, we had an absolutely awesome night. Lots of information was shared. I believe it's going to be helpful to someone. This was a great second night. I want to thank everyone for coming. I want to thank Dr. McGann again for coming and just sharing with us. Please share the information with your family and friends. And if you learned a lot tonight, be sure to come back tomorrow night for our third night of our challenge. Tomorrow night, we'll have a discussion on nutrition and diabetes, and that will be presented to us by Winifred Smith. And that information is going to be absolutely critical if you have diabetes and you are looking for better ways to manage your diabetes. It's really all about the nutrition. So come out tomorrow evening. We look forward to seeing you here. Same time, you can view us on Facebook Live or you can view us on YouTube. Just look for Dr. Dwayne Wood's YouTube channel. And remember, as you're sharing the information, please use the hashtags. The hashtags are Team Destiny and Diabetes Awareness. And with that, I'm going to bid you good night. You have a great evening.